How do oxygen and carbon dioxide cross the capillary epithelium and alveolar cell membranes during gas exchange? A. O2 transporter. B. Osmotic exchange. C. Simple diffusion. D. CO2/O2 pump. The answer is C. Simple diffusion. Gas exchange in the alveoli occurs by the process of simple diffusion. The blood that enters the lung capillaries is relatively low in oxygen and high in CO2, in comparison to the room air that is drawn into the alveoli during respiration. The separation between the capillaries and the alveolar epithelium is thin enough that these gases can exchange across their pressure gradients by the process of simple diffusion. Increased epinephrine would have what effect on stroke volume? A. Stroke volume would stay the same. B. It would cause irregularities in stroke volume. C. Stroke volume would decrease. D. Stroke volume would increase. The answer is D. Stroke volume would increase. Increased epinephrine, released either by the adrenal medulla or by myocardial innervation, increases contractility in the heart, which in turn increases stroke volume. Which of the following valves must blood pass through to go from the right atrium into the right ventricle? A. The tricuspid valve. B. The semilunar valve. C. The foramen oval. D. The mitral valve. The answer is A. The tricuspid valve. Blood in the right atrium must pass through the tricuspid valve to enter the right ventricle. The mitral valve is between the left atrium and the left ventricle. The semilunar valves are located at the base of the aorta and the pulmonary trunk, also known as the aortic valve and pulmonary valve. The foramen oval is a type of shunt that exists in the fetal heart. Its presence in an adult patient is a form of congenital heart defect. The S2 heart sound, dub, is heard during what part of the cardiac cycle? A. Diastole, during the closing of the aortic and pulmonary valves. B. Systole, during the closing of the aortic and pulmonary valves. C. Diastole, during the closing of the tricuspid and mitral valves. D. Systole, during the closing of the tricuspid and mitral valves. The answer is A. Diastole, during the closing of the aortic and pulmonary valves. The S2 heart sound, sometimes referred to as the dub-in-lub dub, occurs in diastole, during the closing of the aortic and pulmonary valves. When pressure within the aorta and pulmonary arteries exceeds pressure within the heart, the cups of the valves fill with blood and snap shut, causing the dub sound. Depolarization is able to travel in a uniform wave through myocardium due to what physiological feature? A. Gap junctions. B. T-tubules. C. Striation. D. Desmosums. The answer is A. Gap junctions. Depolarization is able to travel in a uniform wave through myocardium due to the presence of gap junctions. These junctions allow the depolarizing current to be transmitted directly from cell to cell in the heart. Striation in cardiac muscle is a feature of contraction, created by overlapping thick and thin contractile filaments. Desmosums are strong fiber-like anchors between myocardial cells, and T tubules, while an important part of depolarization, are not responsible for the rapid intercellular communication that occurs as a result of the presence of gap junctions.